Hello, I'm Dr. Daniel Griffin,
And I'm Dixon DiPapia.
and today we will be discussing fungal skin infections.
Right.
You know, you always like to jump in and tell a personal anecdote about a fungal skin infection that you may have had.
Or still do. No, you're using me as your guinea pig here for symptoms, and it's true. I've lived long enough so that a lot of these things have come and gone, so to speak, in my own life. I've had my share of athlete's feet, foot, however you want to pronounce that.
So it affected both feet.
It did.
And you were athletic at the time.
I was. And I've also had the toenail version of that as well.
Mm-hmm.
And fortunately, as we speak, I'm free of both of those entities. And I think the treatments have gotten much better over the last 10 to 15 years. And perhaps that's the reason why I consider myself dermatophyte free at this point. But that may not be the case. I'm just not suffering.
Well, no, actually, that's a really good point. As I often tell patients, often have these discussions, is we live in a world full of microbes. And you'll never completely get rid of all the bacteria. You'll never get rid of all the fungi. It's just a question of keeping it at a level at which you and the microbial world are getting along, so to speak. And what a fungal skin infection is when the fungus has gotten to the point where your body is not getting along.
Right.
And so I think you sort of brought up a few of the manifestations we tend to see, and the manifestations in part are where these are occurring. So if the fungal infection is occurring on the feet, whether you're an athlete or not, we tend to call it athlete's foot or tinea pedis. Right. So tinea, so a fungal infection of the feet. If it was on our body, we might call it tinea corporis. If it's on our cap, our scalp, it might be tinea capitis, and we're going to talk a little bit particularly about that. And then there's an interesting manifestation, tinea versicolor, where we might have a fungal infection and then we get sun exposure, and so we have areas where it's a little pale because that area has been protected from the sun by the tinea.
Got it.
Now these might seem sort of benign, but sometimes they can be so severe. And I'm going to throw in my own personal experience.
Oh, please.
I once had such severe tinea pedis that I had trouble walking.
Right. Oh, really?
And I was a teenage boy.
Wow.
And like many teenage boys, my hygiene probably could have been better. And I was doing a lot of running at this point. And so a lot of the day, my feet would be in sweat-soaked socks, sweat-soaked running shoes.
Right.
And I probably should have promptly got back and cleaned and dried and powdered my feet, but as a teenage boy,
you don't do that. Come on, we didn't do that.
No, I would, we'd run a race, then we'd maybe be in the bus for an hour. Right. There was no...
Sure. Do you remember how itchy your feet were?
I remember pain and bleeding. It was so severe that there was actually bleeding and cracks.
I have not experienced itching that intense in very few other things, perhaps poison ivy, but I was driven to madness sometimes by that. Wake up in the middle of the night scratching your feet. Maybe not so much during the daytime, but certainly in the evenings when you're not thinking about anything else, of course, and then you concentrate on the things that are bothering you. It's not pleasant.
No, and that's one of the big complaints people come with. I have this area and it's very itchy,
right?
And it itches all the time.
All the time.
And it classically occurs in these warm, moist, dark areas. But as mentioned, it could occur all over the place. It can often be complicated by other skin infections. So you may start off with a fungal infection, and then you may end up with an impetigo or a cellulitis, a bacterial superinfection on top.
Got it.
But what about diagnosis? How do you diagnose this?
Well, remember I told you my lab was right down the hall from the dermatology department, so I can tell you the genus and species of the ones that were causing my problem. One was Epidermophytum flocosum. That's the one I remember most because it rolls off the tongue, so to speak. You have to culture them and to find out specifically which one is bothering you. But My feeling is that most people don't do that to proceed to the next thing, which is treatment. But culturing is not a difficult thing to do.
Yeah.
Because you use a sodium hydroxide solution to dissolve away the tissue, and the fungal spores and hyphae are not affected by that at the concentration that's recommended. Then you take that preparation and look at it under a microscope, you can actually see the hyphae. Or you can inoculate I guess it was a Sabarod's glucose agar, as I recall.
Okay.
And you get these beautiful colonies of fungi growing on them that they really photograph very well. They're very photogenic. But to realize what they're causing, of course, is the thing that puts you off about their beauty.
You know, the fungi are beautiful.
They are.
I mean, this is my fungus.
It's
an aspergillus bow tie.
Yes.
And the fungi are beautiful.
They are.
And the fungi are, wonderful in so many parts of our lives. We benefit so much from all the things they do for us. The yeast in our bread, right?
Or
in
certain alcoholic beverages.
Certain beverages. But no, I like the way you go through this because there are several ways that we might make a diagnosis of a fungal skin infection.
Yeah.
And part of it might depend on severity. One is, as we discussed, there are several very classic presentations, which might be compelling just visually and from our history. We may do scrapings. And as you mentioned, you scrape the area, off comes the skin and some of the fungus.
Yep.
And then a little bit of
sodium hydroxide.
Sodium hydroxide.
Sodium hydroxide.
A little bit of sodium hydroxide at the right concentration.
Right.
Sometimes we even heat it a little to speed up the process.
That's true.
And then we look under a microscope and you can actually see the spores and all the hyphae. So you can confirm with a microscope. You may have a microscope available that you're using for your malaria smears.
That's true.
Or other diagnostics.
Yep.
So that's very nice. Dermoscopy has been introduced as a nice point of care test.
Interesting.
Where you look at the affected area and you see these classic comma shapes. Sometimes in a more serious infection, we may actually even be doing biopsy and doing histopathology.
Right.
And as you mentioned, sometimes we're actually going to be culturing.
Yeah.
I'll say in most resource settings, even in fairly resource rich, that's usually not a standard of care.
No.
But it's something that you might introduce should you be having challenges.
Yeah.
What about treatment? Do you remember how you were treated?
I do.
Other than very well and with kindness.
That's right. No, I was treated with what they had available that was non-antibiotic, let's put it that way. I was treated with Whitefield's ointment.
Okay. Do you know what Whitefield's ointment is?
It's zinc oxide
Okay.
and an acid, and I'm blocking on which acid, but it wasn't lactic acid. I don't know. Maybe you can fill in.
Was it an acetic acid, maybe?
Yeah, probably acetic acid.
I'm going to break this down into our tinea that affects everywhere but the head.
Right.
So non-tinea capitis fungal skin infections. And these, you can actually start with your basics, soap and water, keeping it clean, getting it dry. You might even add an azole topical cream to the affected areas. Little pearl, I'm going to say, when you use your fungal creams, remember where the rash was and keep applying it to the same area even as the rash recedes.
Right.
Otherwise, what will happen is you'll start to have it come in and then it'll reform around the edge. And that's actually probably one of the visual clues people often see with a tinea or a fungal skin infection, the primary rash, and then you see these little, what they call satellite lesions.
Right.
So they're little areas where it's spreading beyond. So the ridge, the edge, unlike an erysipelas, unlike a non-purulent bacterial cellulite, won't have a nice clean margin. It'll have a little bit of a ragged margin with little satellite points. It's not always a pure distinction. I have a patient I'm taking care of now who has, for all the world, what looks like a serpiginous edge, satellite lesions, but it's a bacterial, a gram-negative cellulitis. So that's why we might go to some of the other diagnostics we discussed.
Yeah.
We also want to keep the area dry, clean, and we want to combat the moisture, which is really, in a sense, feeding and creating a wonderful habitat for the tinea.
Right.
But now I want to talk about tinea capitis. And so this is fungus on the scalp. And this, I have to say, is a little bit of a challenge when your resources are limited. This is that it's going to be really difficult to treat. And our soap and water or clotrimazole cream will often fail. And so there's a couple things. The first, I'm going to say, this is where we start thinking about cultural sensitivity. One of the modalities we sometimes discuss is shaving the head, which is not always going to be okay in a lot of different cultures. And I'm going to say that for both men and women. There's a lot of cultures where the idea of shaving the head is not considered acceptable.
So if they do allow that, does this mean that the sun itself cures the scalp of the infection, or that it has nothing to cling to like hair?
So it's really mechanical, actually. You don't need the sun. It's not necessarily that it's hiding under the, but that's part of it, right? And the UV can actually help to some degree. But you shave the scalp. Maybe you then apply the cream. But the challenge is that in most situations, you're probably going to need to use a medicine called griseofulvin. Okay? And griseofulvin is a 6-week, once-a-day treatment that is actually fairly expensive. In many of the clinics where I've worked, this is actually a significant part of the budget. But so we'll finish with a couple pearls.
Sure.
We'll just say that we want to be thinking with our fungal skin infections, whether or not it's somewhere on the body or whether or not it's on the head. If it's not on the head, we can usually address this with soap and water, topical treatments.
Right.
If it's on the scalp, that's when we're going to have to start thinking about, do we shave the head, and do we need to use our expensive griseofulvin?
Got it.
All right. Well, thank you for joining us. Look forward to seeing you again.
See you next time.